harm reduction is really an idea of meeting people where they're at and being a supportive environment to people who use drugs. Recognizing that those who use drugs, include our veterans, have a lot of stigma that they face. And often that stigma comes from the criminalization of drug use. And also this idea that addiction is a personal weakness rather than an actual medical entity. And often the same people would also face it even from people like us in the healthcare professional, where they get cares that are treated different. So harm reduction, I think, from overarching theme is looking at understanding that accepting people for who they are, recognizing that addiction is not a personal failure or weakness, and that it is a medical entity and should be treated as such.
I'm a clinical pharmacist and I'm located on the infectious disease team. We have 6 infectious disease doctors and 2 infectious disease pharmacists and 1 social worker. I have 40 patients scheduled to meet each week, and most of my patients either have HIV or they are taking PrEP for HIV prevention, or they have hepatitis B or C, and then some of them are just, other infectious diseases that are more rare. But I see patients and I order labs, and in the VA I can order medications for them in my scope as well.
Yeah, so right now we are trying to focus on reducing harm through sterile syringe programs, through PrEP medications, which is an HIV prevention. The way we're doing that is we are going into our local facilities like the Lake Nona Dam. It's our substance abuse treatment facility, and offering classes and educational opportunities for veterans to know how to plug into those resources. We also do a lot of community outreach, doing different programs like the health department. When they have specific events, we are invited to those. Our homeless program is also an opportunity for us to be out in the field, meeting veterans when they are, really needing us in the community, and avoiding having to come into a healthcare facility.
I can't even imagine what it's like being a veteran, somebody who put their life on the line, defending their country, not being able to sleep when they're deployed, and now having to come back and transition into society. Some of these experiences stay with you, right? And when that happens, there's a lot of psychosocial that occur. And often our veterans would have, in order to try to quiet these voices, often reach out to different substances. And that, I think, is where we often forget that's why it's a addiction, right? Addiction as a medical condition. And they do struggle because they themselves can feel ashamed because of what society says. And that's why they themselves struggle to even come and be honest and open, because the few times when they are honest and open, often we have healthcare providers who don't understand, who says, why don't you just quit? And that's not how it works. Recovery is often a journey, it's not a destination.
When I'm working with my other colleagues, we have a huge social work department. We have colleagues that are in mental health, that are in the homeless program, and I work very directly with them. Our intimate partner violence coordinator is also a point of contact for me to help me bring veterans into these services. Primary care, when veterans present for their regular appointments, they may mention that they are struggling with substance abuse, and those primary care social workers can reach out to me, and we can get them plugged into services as quickly as possible to help avoid any long-term effects from their current situation. So harm reduction is everybody's problem, right? We want to make sure that veterans feel supported, and sometimes where they're at in their life isn't the prettiest picture. So knowing that they can go somewhere when they're struggling with substance use, maybe injecting drugs, like I said, or having multiple partners because they're coping in ways that they didn't expect to, with things like PTSD, depression, anxiety, loneliness. We are offering them an avenue to continue, but be safe.
Aside from giving out test strips such as fentanyl test strip, we are also a big proponent on using naloxone, otherwise known as Narcan, and it's a medication to reverse opioid overdose. And it's something that we feel strongly that everybody should be able to carry. And again, that's part of our comprehensive whole health approach. there's this program of ending the HIV epidemic by 2030. And one of the way is to engage, number one, to diagnose veterans, right? And to increase our screening. Often, many people go through lives thinking that, well, I can't possibly get HIV. I don't need to be screened. People thinking that there is there's a perception that they have a low risk of acquiring HIV. So one of the mechanisms we provide is we increase our screening by being willing to talk about sex. I mean, the joke I have is, I don't know about you, but I don't often talk about sex too with even my best friend. But the idea here is what the VA is all about is about whole health, right? We're not just here to give you medication, but we're here to talk about your well-being, your sexual health. And in doing so, we're able to increase our screening rates for HIV. Then of course, once we screen and should we have veterans who do test positive, again, with the one-stop shop model, we bring them right in. We get the labs, we talk to them, we prescribe the medication, and then we provide close follow-up afterward. And I think that because of that, that's why our rate of what we call undetectable viral load is over 96%. So veterans who come see us, more than 96% of them have undetectable viral load. Of course, that's not perfect. And here at the VA, we're aiming for perfection. So that 4%, we continue to focus. We have our social worker to reach out, we have our pharmacists reaching out, because again, creating that safe environment, recognizing, what are the barriers? Once we recognize that there are barriers, we do the best that we can. So these are some of the services we provide here in the ID clinic to help diagnose as well as treat HIV.